top story at 10. It passed the House, and now the Senate will vote on a bill to clarify who can dispense and administer the opioid overdose drug Naloxone. 600 Side's McKenna King is live in studio to explain the potential liabilities and how this bill could put healthcare systems at ease.
Current legislation doesn't quite say what it means. It states that any prescriber or pharmacist may prescribe and dispense naloxone, but with a more broad underlying meaning, lawmakers are attempting to clear up the confusion.
On opiates, narcotics, heroin, oxycodone, OxyContin, there's one drug that will reverse those effects that we use frequently, and that's naloxone.
A medication used to counter the effects of an opioid overdose, highly useful in the midst of an opioid epidemic, with around 70,000 overdose deaths in the United States just last year.
We have given it to more first responders, law enforcement are utilizing it now, in the recognition that we have a huge problem of opiate addiction in this country.
And in order to combat the problem, Idaho lawmakers legalized the possession and administration of naloxone by a regular person in 2015.
The way that the language in the original bill was written caused a couple of large healthcare systems to question whether or not there was a limited liability associated with that.
That 2015 bill stating any prescriber or pharmacist may prescribe and dispense the life-saving drug, but to reduce any concerns regarding potential liability, Wood brings House Bill 12 to the floor in 2019.
All it did was change the language and make it very clear that people who did not have prescriptive authority could become, in effect, naloxone ambassadors. They could distribute naloxone.
Adding the words health professional to the description and attempting to raise more awareness to the public the usefulness of carrying naloxone.
If someone asks for it for themselves, they actually can run it through insurance. There are some insurance plans, even private insurance plans, that are covering it 100%. The cash price, though, can be upwards to about $150.
And while administering the medication has proved to be life-saving in many instances, it doesn't rule out the strict importance of calling emergency crews immediately after.
The best way to compare it is to using an AED, or an automatic external defibrillator. You wouldn't defibrillate somebody out of cardiac arrest without calling an ambulance. Naloxone is the same thing. You're reversing somebody's effects of narcotics, which is respiratory depression, potentially cardiac arrest. They still need to be evaluated.
Both opioid antagonists, naloxone and Narcan, are available to almost anyone in the form of an injection or a nasal spray at a pharmacy.
So how safe is this medication to administer?
So it's fairly safe. Representative Wood told me that the FDA is working to get it over the counter just in the next couple of years. So it's safe enough that either you and I could get it right now and we'd likely be okay.
All right. Thanks, McKenna.
Yeah, anytime.